Hi, I'm Aoibhin. I'm a chartered physiotherapist and a specialist in women's health. Today we're going to look at some exercises that you should be doing if you're pregnant, provided that your doctor hasn't told you to avoid any of them. We're going to start off with the pelvic floor muscles. The pelvic floor muscles are really important during pregnancy and beyond to help maintain bladder and bowel control. So to begin with, we're going to think about where they are. They're from the back of your pelvis at your sacrum to the front at the pubic bone. Okay, so what you're going to do is try and imagine that you're stopping yourself from passing wind or passing urine all at the same time. So drawing that upwards and inwards. Well done. You can aim to hold these contractions for 10 seconds at a time and aim to repeat them 10 times. But remember, everyone's going to have muscles that are different strengths, so you're going to have to work at your own level. And release them back down. Same thing again, so drawing up. Imagine that your pelvic floor muscles are a lift and you're going from the first floor, second floor and up to the third floor. So really using them strongly. Holding them there, keep breathing, and you notice there's no movement in the shoulders and you're trying not to squeeze those bum muscles either. And then releasing back down. Make sure on the way back down that they come down to the ground floor again if you're thinking of that lift. Important for the muscles to release and relax between each exercise. Okay, so we're going to move on now onto your side molar. When you're turning, use your tummy muscles for support. Keep your elbows underneath your head. And use your hands to help guide the movement too. So for this, you're looking to contract your lower tummy muscles. These are really important to help support your back during your pregnancy and to help in the recovery of your abdominals afterwards. So to begin with, you're going to breathe in gently, and as you breathe out, imagine that you're hugging baby in towards you. Super. Holding that as you breathe in gently, and then releasing it again. Okay, same thing again. This time try and engage your pelvic floor muscles at the same time. So you're trying to draw up the pelvic floor and draw in the lower tummy. Well done. Holding it as you breathe in, and then breathing out. I would tell patients to aim to give that baby 100 hugs a day to really strengthen up those abdominals. Good. From there now we're going to go onto your back with your knees bent. When you're turning again, use those abdominals, use your hands for support. And when you're pregnant, especially later on in the pregnancy, if you're lying on your back, it's an idea to have your head and shoulders elevated to take the pressure off your heart and lungs and to avoid any dizziness. If you're feeling dizzy at any point, you turn onto your left side to get back to normal. Okay, so let's think about engaging your pelvic floor and your lower tummy again. And this time we're doing what's called a pelvic tilt. So you're going to try and flatten that lower back into the mat, allowing your tailbone to lift gently. Good. Super. So you can see the movement happening at the pelvis. You're holding that position as you breathe in, and then returning to neutral as you breathe out. And do one more like that. With this exercise, just focus on breathing gently. You don't have to worry about the exact breathing pattern. We normally exhale for the effort, but it's really good to get into a practice of slow, controlled breathing, as that can help you in labour as well. One more. This is a particularly good exercise for low back pain and pelvic pain. Good. After that, now onto all fours. So if you watch, when you're turning, you want to think about engaging your abdominals, rolling onto your side, and then onto all fours. And if you're trying to turn over in bed, this is the better way to turn if you've got pelvic girdle pain than turning over. So onto all fours. Thank you. So to begin with, you're starting with a slight curve in your lower back. And you're going to now engage your lower tummy and the pelvic floor, and then draw your tailbone underneath you so that you're arching up through your spine, starting at the lower and finishing at the upper, looking in towards your tummy. Hold that position as you inhale and exhale as you return, starting at the base of the spine, and you're really trying to make the spine move in sequence. Good. One more like that. So drawing in the pelvic floor. This is a really good exercise for just a general stretch of the back. You can also work your core muscles in this position. Well done, that's perfect. And the last exercise we're going to show you, you're going to sit for, and it's to stretch that upper back. Just be careful when you're moving from position to position. Okay, so we're going to stretch the upper back. It can get really stiff during pregnancy because of the increased bust size and also the changes in your posture, which can lead to pain and strain in that upper back. So you're going to start off, Nuala, with your hands behind your head. Make sure you keep your shoulders down, and from there we're going to inhale to prepare. As you exhale, you're engaging the lower tummy using those muscles that we've already been talking about. And then inhale as you try and extend that upper back. Well done. You're trying not to arch through the lower back, holding it for the next breath, and then returning to the starting position. One more like that, so engaging your lower tummy. Well done, releasing, then engaging again, and then extending on the next breath. So you feel a stretch around the bra strap area. And then returning to your starting position, release those muscles. Well done, you can lower your hands down. So all of these exercises, you can do 5 to 10 repeats, and do them every day if you can. Hopefully they'll help you get through your pregnancy with minimal aches and pains. Hope this helps.